Asthma Allergy Centers, Dr. Ravi Polasani. Welcome back to the show.
Okay, thank you very much. Thank you for giving me the opportunity to talk about spring allergies today.
Yeah, it's nice to have you here. Dr. Moody has been with us quite a few times over the last couple of years.
Yes.
Obviously, dealing with the pandemic. And I think a question that I personally have heard this week from a couple of people, do I have allergies? Or is it possible I might have COVID? There's some commonality in the symptoms, isn't there?
Yes, that's true. Now the allergy symptoms, are mostly, sneezing, runny nose, itchy watery eyes, and sore throat, headache. Now the COVID, this new COVID virus, Omicron BA.2, the new virus variant, also symptoms are similar to allergic rhinitis. So they do have sneezing, like sniffles and stuffy nose and sore throat, as well as headache. But the other symptoms that the virus can have, with the virus have, myalgias, like a body aches, and fever. So in that case, you think about the virus.
And
So it's better to get the testing done for virus.
Yeah.
That's what we recommend nowadays.
And you could conceively have both things.
You can have both things.
Yeah.
Yeah, that's why it's difficult to distinguish between these two.
Plus the common cold, the flu. And it's still flu season, isn't it?
Yes, still flu season. Yes, that's correct.
Well, let's talk about allergies because there's seasons for allergies, and it's I guess when the season changes from winter to spring, that's when we see people's allergies flare up. What is it about the change in season that causes the flare-ups?
So the trees, release pollen from, going from winter to spring, especially the wet winter, the more tree pollen that you expect. And it's a particle, fine particles in the air that people inhale. You get into your eyes and nose, and your immune system reacts and then makes antibodies, and then certain allergy cells in our body, they break open, release chemical mediators that cause symptoms.
We don't see any buds on trees yet. There's no blooming, but there is change, that there is some botanical change that's going to affect people, even when you can't see it.
Yes. So now the warmer the weather, you see more pollen in the air, and windy days and more wet days, like a rainy season. That if you have more rainy season, you can have more pollen in the air.
Do we have, so when summer turns to fall or spring turns to summer, do we have, are there some more things that happen that
Yes.
would affect people?
Yeah, going from spring to summer, we have mostly grass pollen. Grass pollen starts end of June and goes on until August. And then from August, usually in Michigan, middle of August, you have ragweed season or other weeds, and it goes on until big, like first frost, heavy frost, and then until then people can have seasonal symptoms, like a hay fever. That's what we used to call. Started 120 years ago.
From the harvest of hay.
Yes,
right?
harvest of hay. That's correct.
I know people that they've lived their whole life not suffering from allergies, and then suddenly at some point they're getting them. They're getting
Right. Usually it takes minimum 2 seasons you have to inhale the pollen. Then your immune system makes antibodies, those allergic antibodies. Once you have enough antibodies, then every time you inhale, you have symptoms.
And on the other hand, I know people that have had allergies and then suddenly they stop. They don't bother.
Yeah, the allergies are more common in kids. They can grow out of allergies when they're late teens and early 20s, and then 30% of people, their symptoms may return late 20s, 30s, and they're going to stay. But allergies can start any time. Yeah, but it's more common in children.
And as I get older, I understand there's a lot of things that are going to change. My eyesight's different. Everything. So is there going to be something that happens to a person's immune system as they age that's going to make them more vulnerable to?
It's a good question. Yes, with the advancing age, your immune system is not as tolerant these allergens. It's less tolerant. It makes less antibodies, so your reactions are less and less over time. So, and then also exposure counts too. So more exposure, more issues, and so over time your symptoms are less.
Are there things people can do to either minimize the effect of allergy season in advance before they start experiencing symptoms?
So the pollen's count is usually highest from 5 a.m. until 3 p.m. That's when, when you're outdoors early in the morning or opening your windows and doors, more pollen exposure, more symptoms. So you can do some lifestyle changes. That way, less avoiding allergens, the symptoms are less. And in rural areas also, they dry their clothes outdoors. The pollen gets onto the clothes, and then, also when you're outdoors, like picnic, whatever you do, playing sports, when you come home, you take shower, put new different clothes, so that way less exposure to pollen.
Get it off you.
Get it off of your body, so that you can do that.
I'm glad you mentioned time, because last week Congress began the process of eliminating changing times.
Right.
And without any kind of scientific testimony, no medical advice,
Sure.
testimony, they just decided we're going to do it. I'm curious, what do you think the effect is if we are on one time all year round, and is daylight savings time, is that the time we should be sticking with, or is standard time the time we should stick with?
I think we should stick to standard time, so that way less exposure to allergens,
Well, personally, I thought that would make more sense.
More sense, right?
Yeah.
Makes sense, yes.
But
Yeah.
I guess. Did they ask you?
Right, they don't, right. They come up with their own.
But I have seen some doctors come out with some commentary about the negative effects of back and forth, but also the negative effects of having it be daylight savings time all the time. More exposure.
More, right, sure. So because you're doing more things outdoors, and
So the pandemic is still with us. The latest variant has similar marks to the allergies, various allergies. We can test for COVID. How do you test for allergies?
So allergies we test with like skin testing, prick skin testing, and intradermal, like putting under the skin to various allergens. It takes 15 minutes to read the testing. That we grade it, so you can have mild reactions or moderate to severe reactions, and then based on the testing, then we decide what treatment. Explain about allergen control measures first, and then the medications, and immunotherapy, which is desensitization.
We've seen people that have had COVID have long COVID, and some of the symptoms of long COVID: loss of taste and smell, suppressed immune system. Are you seeing in your practice people that have long COVID that are with a suppressed immune system developing additional problems?
Yes, I see that all the time. People coming with ongoing symptoms, especially asthma symptoms, shortness of breath, and even little exertion, and continuing nasal congestion and increased allergy symptoms following COVID infection. So I think they need to be followed closely and treat those symptoms. I think they do better.
The fourth shot, the booster, it's not yet recommended for the general population, but it is, I believe, being recommended for a certain population, particularly those with pre-existing conditions or more vulnerable.
Right.
What's your recommendation?
Yes, I do recommend the fourth shot for those people who have a lot of comorbid conditions, older folks, they do benefit from the fourth booster injection. That boosts the immune system, so they make antibodies, so it fights the virus, So less complications, less admissions to hospitals, less burden to healthcare system. I would definitely recommend it.
As we've heard, it's not necessarily going to prevent you from getting COVID, but it will.
It helps to minimize the symptoms. And then where the allergy, the antibodies are losing over time. So lasting for only 3 to 4 months. So even, I got booster a while ago, I may not have enough protection, So unfortunately, we're not keeping those antibodies.
All right, and these allergy remedies, there are so many over-the-counter products. How do you know what's right? I would be afraid to trial and error my way through 3 or 4 different products to get relief. What do you recommend?
Usually, antihistamines, they're over-the-counter now. Used to be prescription. Now they're freely available. People buying them, taking them. So depending on how bad your symptoms are, so mild symptoms you're okay taking antihistamines, they do help, but people are moderate to severe symptoms or underlying asthma, those medications may not be enough. So in that case, we use nasal inhalers. Those are inhaled steroids. They reduce the congestion in the nose and also cuts on the drainage. Whereas antihistamines help only sneezing, itching, runny nose, not the congestion, not the drainage. So the combination of medications work good for allergies. The reason being, when allergy cells release different mediators, so you're targeting those mediators with the different medications. So that's why one medication may not be helpful. Now I see time and time people using decongestants, the nasal decongestants. They cause a rebound congestion, and then having angry-looking nose and develops rhinitis medicamentosa condition with this using over-the-counter nasal decongestants a lot. So
is it all hitting just your respiratory system?
I'm sorry.
Is it just your respiratory system?
Yeah, it's a respiratory system, upper airway mainly.
And if someone has a more severe situation, they should come see you.
Right. If the medications fail to control, then they should come and see me. So what we do basically, the testing and what kind of therapy they need, especially the immunotherapy, where they get desensitized. They can tolerate these allergens better, and they can grow out of allergies. The immunotherapy not only helps allergies, but also helps asthma, and even eczema also.
That's a double whammy.
Right.
Yeah.
Sure. There are different immunotherapies. Now, oral immunotherapy is available too, where you can get sublingual, like under the skin drops, even tablets available now for seasonal allergies too.
Oh, really?
Yes.
All right. Well, it sounds like if you have issues, luckily we have the Asthma Allergy Center here in Jackson on Lawrence Avenue, and Dr. Polasani would love to hear from you. Well, great to see you. Thanks for being on our show.
Thank you very much.
From Asthma Allergy Centers, Dr. Ravi Polasani.